Guys, how are you? I think so that you would be fine and enjoying a sound health. Today, my topic is on diabetes, its symptoms, and its types and risk factors for type 2 diabetes, prevention of type 2 diabetes, and management of diabetes, and preventing diabetes problems. So, let's first start with diabetes. Diabetes is a disease that occurs when your blood glucose, also called blood sugar, is too high. Blood glucose is your main source of energy and comes from the food you eat. Insulin, a hormone made by the pancreas, helps glucose from food get into your cells to be used for energy. Sometimes your body doesn't make enough or any insulin or doesn't use insulin well. Glucose then stays in your blood and doesn't reach your cells. Over time, having too much glucose in your blood can cause health problems. Although diabetes has no cure, you can take steps to manage your diabetes and stay healthy. Sometimes people call diabetes a touch of sugar or borderline diabetes. These terms suggest that someone doesn't really have diabetes or has a less serious case, but every case of diabetes is serious. Insulin is a hormone made by the pancreas that helps your body use glucose, blood sugar, for energy. Insulin helps to control blood glucose level. And hormone, what you think about hormone? Hormone is a chemical. One part of your body makes and releases it into your blood to help trigger or control functions in another part of your body. Now, look at the types of diabetes. What are the different types of diabetes? The most common type of diabetes are type 1, type 2, and gestational diabetes. And now let's look at type 1 diabetes. If you have type 1 diabetes, your body doesn't make insulin. Your immune system attacks and destroys the cells in your pancreas that make insulin. Type 1 diabetes is usually diagnosed in children and young adults, although it can appear at any age. People with type 1 diabetes need to take insulin every day to stay alive. Now, there is another type which is called as type 2 diabetes. If you have type 2 diabetes, your body does not make any insulin or use insulin well. You can develop type 2 diabetes at any age, even during childhood. However, this type of diabetes occurs most often in middle aged and older people. Type 2 is the most common type of diabetes. Another type of diabetes is gestational diabetes. Gestational diabetes develops in some women when they are pregnant. Most of the time, this type of diabetes goes away after the baby is born. However, if you have had gestational diabetes, you have a greater chance of developing type 2 diabetes later in your life. Sometimes, diabetes diagnosed during pregnancy is actually type 2 diabetes. And the other types of diabetes which are occurred in some individuals which are less common types that include monogenic diabetes, which is an inherited form of diabetes, and cystic fibrosis related diabetes, these types. And as you know that in 2015, 30.3 million people in the United States, or 9.4% of the population, had diabetes. More than 1 in 4 of them didn't know they had the disease. Diabetes affects 1 in 4 people over the age of 65. About 90 to 95% of cases in adult are type 2 diabetes. And as far as it is concerned, who is more likely to develop type 2 diabetes? So, you are more likely to develop type 2 diabetes if you are age 45 or older, have a family history of diabetes, or are overweight. Physical inactivity, race, and certain health problems such as high blood pressure also affect your chance of developing type 2 diabetes. You are also more likely to develop type 2 diabetes if you have pre-diabetes or had gestational diabetes when you were pregnant. Learn more about risk factors for type 2 diabetes. There are some health problems which people with diabetes can develop. Over the time, high blood glucose leads to the problems such as heart disease, stroke, kidney disease, eye problems, dental disease, nerve damage, foot problems. You can take steps to lower your chances of developing these diabetes related health problems. What are these health related problems? These are heart related diseases. The heart disease or stroke. Diabetes can damage the blood vessels and lead to heart disease and stroke, and you can do a lot to prevent heart disease and stroke by managing your blood glucose, blood pressure, and cholesterol levels, and by not smoking. And then low blood glucose, what is hypoglycemia? Hypoglycemia occurs when your blood glucose drops too low. Certain diabetes medicines make low blood glucose more likely. You can prevent hypoglycemia by following your meal plan and balancing your physical activity, food, and medications. Testing your blood glucose regularly can also help to prevent the hypoglycemia. What is diabetic neuropathy? Diabetic neuropathy is a nerve damage that can result from diabetes. Different types of nerve damage affects different parts of your body. Managing your diabetes can help prevent nerve damage that affects your feet and limbs and organs such as your heart. And there is also diabetic has kidney disease, also called the diabetic nephropathy. Is kidney disease caused by the diabetes? You can help prevent your kidneys by managing your diabetes and meeting your blood pressure goals. What are the food problems? Diabetes can cause nerve damage and poor blood flow, which can lead to serious food problems. Common food problems such as a callus can lead to pain or an infection that makes it hard to walk. Get a food get a food checkup at each visit with your healthcare team. And you may have the eye disease. Diabetes can damage your eyes and lead to low vision and blindness. The best way to prevent eye disease is to manage your blood glucose, blood pressure, and cholesterol, and to not smoke. Also, have a dilated eye exam at least once a year. Sometimes gum disease and other dental problems are also occurring in diabetes. Diabetes can lead to the problems in your mouth, such as infection, gum disease, or dry mouth. To help keep your mouth healthy, manage your blood glucose, brush your teeth twice a day, see your dentist at least once a year, and don't smoke. Sometimes you have sexual and bladder problems. Sexual and bladder problems are more common in people with diabetes. Problems like erectile dysfunction, loss of interest in sex, bladder leaks, and retained urine can happen if diabetes damages your blood vessels and nerves. Treatments are available to help control symptoms and restore intimacy. Depression is common among people with a chronic or long-term illness such as diabetes. Depression can be treated so tell your doctor if you feel sad, hopeless or anxious, and sometimes diabetes is linked to some type of cancer. Many risk factors for cancer and for diabetes are the same. Not smoking and getting recommended cancer screening and can help prevent cancer. Sometimes dementia is related to diabetes. High blood glucose increases the chances of developing dementia. Tell your doctor if you are forgetful, because dementia can make it hard to manage your diabetes. Sometimes people have sleep apnea and diabetes. People who have sleep apnea, when you stop breathing for short periods during sleep, are more likely to develop type 2 diabetes. Sleep apnea also can make diabetes worse, and treatment for sleep apnea can be helpful for such type of people. Diabetes has link with the heart disease and stroke. Now I am ending my topic, and in my next topic, I will talk on another topic which will be related to diabetes, related with the stroke and heart disease. So, guys, if you like my video, then subscribe it and have a wonderful, nice day. Thank you very much.